Apply a very strong topical anesthetic above the intended implant site. Then, take a needle from an anesthetic syringe and stick it through the gingiva until you make contact with the bone. Do this on multiple surfaces on the lingual, incisal, and facial surfaces of the bone. The intention is to measure the thickness of the gingiva at the intended implant site. Make a study model of the patient's mouth. Extend your impression as far lingually as you can so that you can pick up any concavity on the lingual side of the mandible. Once you've poured your model, draw lines in the area where the tooth has been extracted, from mesial to distal, in line with a mesial developmental groove, and from facial to lingual, bisecting the space between the adjacent teeth. Once you've done that, you can then fabricate your stent. Your stent will contact all the occlusal surfaces of your teeth and extend a little bit lingually in the area of the extraction site. You will leave an opening in the stent directly above the extraction site. Now cut a line from the facial to the lingual through the model, and this line should be on the exact site where you intend placing the implant. So it should be midway interproximal between the two adjacent teeth. Using the measurements you made when you sounded the gingiva in the patient's mouth, draw lines in the cut on the facial-lingual flat surface of the model. These lines will determine and indicate to you the outline of the available bone. Measure the facial-lingual dimension of the bone. On this model, you will take into account any concavities that may be on the lingual side of the mandible. You'll then draw two parallel lines centered in the bone between the most facial and the most lingual border of the bone, again taking any concavities into consideration. You'll then draw two parallel lines centered into the bone. These parallel lines are going to determine the position of the insert that you're going to be attaching to the bone. So if you're going to be using a 4mm insert, make the lines 4 mm apart. If you're going to be using a 3mm insert, make the separation between the two lines 3 mm. The size of the insert will be determined by the amount of available bone. Now cut a groove into the model using a cylindrical burr. Cut the groove exactly between the parallel lines. Tack the correct insert into the long axis of the groove and place the metal sleeve over the insert, being careful not to dislodge the insert from the model. Then carefully place the jig over the insert so that it fits firmly against the model without dislodging the insert. Then tack the insert to the jig, making sure that you don't get any bonding material on the insert itself, because you do want to remove it from the metal sleeve. Remove the plastic insert from within the metal sleeve. That will leave you with a prefabricated jig with the metal sleeve now attached to the jig. Place the guide in the patient's mouth. Take the correct size verification point and push it through the metal sleeve so that it penetrates the gingiva and makes contact with the bone. Now take an X-ray with that new assembly and look at the direction that the point is aiming at. That will show you the direction that the implant drill is going to follow. You can also use the verification point to measure and calculate the amount of bone that is available to place an implant. Before the implant drills are used, always use a verification point. The sharp end of the point is sharp enough to penetrate the gingiva. Make sure that you anesthetize the gingiva and place the point through the metal sleeve while the guide is in the mouth. This will allow you to pre-verify that your guide is accurate before you actually begin the osteotomy.